everyone, good morning. This is Midwife Sally, and yes, I am back to Ghana. I said that I'm going to visit 3 pregnant women, and today I'm here in Pampam, my own district, to do the first visit, and I'm so happy and excited. Good morning, Aunt Mary.
Good morning.
Wow, I'm so glad to meet you.
It's my pleasure.
How is life?
Everything is okay.
Okay, so my main aim of doing the Midwife Sally is to promote maternal health and to help as many women as possible. By God's grace, we have reached thousands of women across the globe, not only in Ghana. I don't know which country we haven't reached, okay, and we continue to help a lot of pregnant women. So that is why I'm here this morning. How has your pregnancy been faring?
It has been good so far. We are hoping for the best.
You're hoping for the best?
Yes.
Wow. Okay, so how far are you? How many months?
27 weeks, almost 7 months.
Oh, okay. So I'm using just about 1 minute to review her antenatal book. Yeah, so I'm going to do this more often. This is the first week. But after that, I'm going to come to your home. You can book an appointment with me. I'll come and do this for you. Okay, I'll go through and then see her race, washes, her weight and all that. I'm already seeing some of them already. Hey, interesting, okay? Yeah, so women who are coached always do better than women who are not coached. Okay? So I have 2 concerns. Just glancing through within less than 30 seconds. I see that you've had a previous CS before. And I see that your HB is around 9, 10. So she needs to work. We need to talk about these 2 things quickly. Let's talk about the previous CS. How long has it been?
It's been 1 year, 8 months.
1 year, 8 months. So what is your doctor saying?
They said when I go for antenatal, they said I can't give birth there because of my previous years. So I'll move to a place where there is a theater.
Okay, so they want you to go to a hospital where there's theater.
Yes.
So are they going to do a CS again, or they are going to try vaginal birth?
I want to try the vaginal birth. They said I can, but it's 50-50. So it's better to go to a facility where there is a theater.
And how long have you been trying? How long have you been trying? How long do you get pregnant after the first baby? How old was the baby, your first baby?
1 year, 3 months.
1 year, 3 months. Okay, so in my hospital where I used to work before I traveled, at least the woman should have 2 years, like 2 years complete. So if the baby was not 2 years before you got pregnant, they would have to do another 6 years. And I know a lot of people are watching, people from international community. Somebody will say, oh, don't worry, you can give birth. But one thing I have realized is that our facilities we have here is not like them. And the monitoring we have here is not like the outside, okay? So in our system, at least 2 years, then they will let you try vaginal birth. So think about it well and then coordinate with your doctor, okay? So my second concern is, so as I'm saying, in Ghana or in Africa, we will let the woman complete the 2 years before getting pregnant. If you got pregnant less than 2 years, they will not allow you to try a vaginal birth. If it has changed, let me know, but that is what I know. And elsewhere in foreign countries, their technology is really advanced. I just came from a developed country, so I know exactly what I'm talking about. You can't compare the 2 systems, and so you have to be smart and careful. Just listen to your doctor and you get the best outcome. Yes, and then your HB. How far with that?
Yeah, when I went for antenatal yesterday, they were not having the strips. This one is for last month. So I wanted to check to see if there is any improvement.
So what were you doing to improve?
We changed the medicine I was taking. So I took Totema instead, and they also told me to take turkey berries.
So Totema and turkey berries.
Yes.
Okay, so that's what you've been doing so far.
I wanted
Okay.
to check to see if there
Are
is
you
any.
able to eat well?
Yes, please.
Oh, okay, that's fine. Yeah, so we want your HB to be high. The reason is that if you have high HB during pregnancy, the probability of you bleeding is low. And even in case you bleed, let's say you have HB of 13 and you bleed, it will even drop to a place like 11 or 10, and we are still in the safety zone. But if you're around 9 or 8 or 7 and then you bleed, see where you are going. You are going down, okay? And you know the blood that you have carries a lot of oxygen, and that oxygen is what helps your baby to thrive and you, the mother, to thrive. So you want your HB to be high. It will prevent bleeding. You will be you like after birth you will be better and all that. So with all that you are doing, it's fine. You can also add fruits in between your diet. Fruits that contain vitamin C. Add them. Yes, you can add them. And all our fish, abobi, egg, beans, anything that is protein based, green leafy vegetable, they'll go a very long way. Yeah, so just try little by little and then you get there. Let me go to your specific question. Maybe you have your specific question.
Yeah, I wanted to know when I can go to the hospital where I want to give birth. That's which month should I go there?
Okay, to change your hospital.
Yeah,
Like where you are going,
I go for the antenatal.
you can't give birth
I
there
can't give birth
because
there.
they don't have theater.
Yes,
Okay.
yes, yes.
So it's better you go and then they assess you and you understand the hospital protocol. So you can go, let's say, within when you are 7 months, 8 months, you should go to them. Then they will let you know their protocols. If you need to donate blood, whatever you're supposed to do, it's fine. Okay. Then I think that's okay. Another question.
In case maybe this because the reason for my previous CS they said it was
CPD. Yeah, I've seen it.
and I don't know if it's something that can reoccur. Like let's say if I go to the hospital and they say I can give birth vaginally, is it a possible?
So every pregnancy is different, and they will take a scan. I'm sure when you are close to your delivery, they will take a scan. They will see the fetal weight, and sometimes they can even measure the baby's head circumference and all that. So they will be able to tell. Okay, but every pregnancy is unique and very different. But with all that I have explained, I do not expect that maybe you would like push that, because let me tell you, like the risk of having giving birth a short time, then getting pregnant again, and going to trying vaginal birth is uterine rupture. Okay, it's uterine rupture. You contract. If the healing is not properly done, then the person can rupture. And if there is no effective supervision, the monitoring is the problem. Okay, elsewhere they have a lot of machines. They have doctors. They have midwives. Like when they are when we are monitoring, just one woman in labor, about 6 monitors. Yes. And so you cannot compare the two systems. That's why I'm saying that if you go to the hospital and then they tell you that because of your circumstance, it has to be another CS. For me, I think that because of our system, our monitoring and these things, you have to cooperate. But if you go and the doctor thinks that they can do the monitoring, they can check, they feel that you are fit, then that is completely okay. But just cooperate with them for the best outcome. You get it? Okay. Yeah. You have another question? Are you sure? I'm here for you. Any question? So should I ask you?
Yeah, you can ask.
Okay. So you've packed your hospital bags already.
Yes, please.
You know the hospital you want to go and deliver.
Yes.
You've already decided. Oh, okay. That's fine. So as you are getting ready to give birth, get your hospital bag ready. Learn about how to reduce your stress and your anxiety, how to cooperate with birth, pain management. So when you go to the doctor, ask them how would they manage your pain after 2 years, because those are some of the concerns, your recovery, breastfeeding, all those things. And I believe that you are going to be fine. Yeah. Okay, so it's been good coming to you. At least I've been able to identify at least 2 things that you should pay attention to: the previous years and also your HB. Yes, I believe everything will go well. Have a great and wonderful day. It's been a pleasure speaking to you. Thank you. Bye.
Bye.